humid, but quite a beautiful day. Um, and it is the morning. It's 9 a.m. For those watching rather from the U.S., good evening. Um, Europe would be the afternoon, I think. No,
Mm,
so.
yeah. Hi. So, what did you put as the pinned comment? Sorry, I'm trying to set up Facebook.
So comment with your questions early so we can answer them live. So one thing we've noticed in these lives is people ask so many questions towards the end, and I start to freak out because I want to make sure we get the questions in while my mom is here, because she's, the mega expert in all this, right? So if you have a question, please type it in the comments early, because first it guarantees for sure we'll get to it. If not with my mom, at least I will get to it certainly by the end, or maybe even in the beginning when I'm talking about VMV. And we have people who are monitoring your comments, so make sure you get your comments in early, especially if they're a little complex, because the last few times we've had comments come in right at the end and it's like, oh my god. So yeah, and granted, it's my job to stay calm, so that's not on anybody, but it increases the chances of getting your questions answered, if you get them up earlier. So do comment with them, and we're making sure lots of people are watching to make sure we don't miss them. Okay, so we're about 5 minutes in. Welcome again to our Skin Sights episode on Maskne, which is this trending topic now. And I wonder, I wonder if Maskne might be trending more in the Philippines because it is so hot and humid here, and that's sort of our biggest struggle. Where in Europe and the United States and other areas, some parts of the United States are as hot and humid, but there's so many other types of PPE skin problems and skin problems related to all the stuff that we have to do now to stay safe in COVID. Just realized I have a thing. So, as usual, I'll be talking first about VMV products that can help during this time, and then I'll bring in my mom, dermatopathologist, Dr. Veralia Rowell, who's phenomenal and awesome, and she can answer your questions and stuff, to talk more about what causes these things, etc., etc. And then I'll answer stuff about VMV that you might have, the questions about VMV that you might have. So with VMV's approach to pandemic or skin problems related to the pandemic, we take sort of a three-pronged approach. One is prevention. For those who have seen our lives before, you already know it's like our middle name. It's prevention, 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 protection, and then repair, right? The prevention thing is so important because there is relatively little that we can do to avoid all the important things to protect ourselves now. Okay, so for example, we have to be washing our hands very frequently, and we have to wash them properly, right? So it's the whole 20 minutes, it's in between the webbing of your hands, it's under your nails and all of this, and just period, excessive cleansing of the skin anywhere in your body, which is why you shouldn't be cleansing your face more than maybe twice a day, or even showering more than you really need to. Just the simple fact of over cleansing the skin can already irritate it. It's just a lot of exposure constantly to water and soaps. The other big thing, the European Task Force on Contact Dermatitis, this has become such a problem that the European Task Force on Contact Dermatitis released a statement to try to help people prevent these problems. One of the main things they talk about is don't use soaps that are fragranced. Duh for us, because we don't use allergens, right? But to add to that, you don't want to use hard soaps if you can help it. Hard soaps, because of the way they're made, they're very drying. They have a much higher pH than your skin's natural pH. So if you can opt for a cream cleanser or a liquid cleanser, that's already better. No allergens, no fragrance, no preservatives, no dyes. So obviously what we use at home is Superwash. This is my personal Superwash. I think you guys have heard me before. I don't I don't ask for stocks from the stores or from the plant because we want to make sure whatever stock we have is available to the public. So I'm really using my stuff. So apologies if they're kind of banged up. Superwash is a great option for washing your hands, but also even any of our super skin cleansers specifically. They're made for the face, which means they're very gentle, but they could totally be used on your hands as well. Again, because our hands are already so dry and irritated, I would recommend the cream cleansers and not the scrubs. But if you work in an environment, if you're a health worker, scrubs might actually come in handy as well, no? But at the very least, they do have virgin coconut oil, they don't have fragrance, they don't have irritants, and crucially, and this is important, we kind of tackled this last week, they both have SLS. So SLS and this has SLS. Yes, no, they both have SLS, sorry. So SLS and SLES have gotten a bit of a bad rap, and it's one of those ingredients that people just say they're bad without really understanding. So SLS and SLES can both be irritating when used in very high concentrations, which is not the case here. Plus, there's no other allergens in these things, so you really reduce the risk of irritation. But why SLS is so important is SLS is derived from coconut oil and is a well-known, well-established antimicrobial. So it's a great option during this pandemic. So in our plant, for example, and in our clinic, we definitely have people come in and they don't just wash the hands first. They wash their hands with Superwash or a super skin cleanser, and they don't just wash the hands. We ask them to wash up until the elbows, and many times because people commute, right? So we'll ask them to wash their faces too. That's part of our standard protocol. The other thing is to try to immediately after washing your hands, apply an emollient, a moisturizer, okay? Obviously, anything with virgin coconut oil is something we'd recommend because it's so good at protecting the barrier of the skin. And with all this excessive scrubbing and washing, it's the skin's barrier that really becomes disrupted. And that's where cracks start to happen and it gets extremely dry. But in addition, those cracks become welcoming for secondary infections, which is kind of the last thing you want to be dealing with now in the age of COVID, right? So after you wash your hands, you can use almost any moisturizer that you like. We have a few, all of which have virgin coconut oil. This is Mommy Coddling. It's a big favorite among, moms and babies. It's got virgin coconut oil. It's got monolaurin, which is also an antimicrobial. So, sorry, VCO is also antimicrobial, right? So monolaurin, VCO are antimicrobial. They're very soothing. They're anti-inflammatory, and they're great for the barrier. This is Mommy Coddling. This is 1635. It's an aftershave soothing salve with virgin coconut oil. You could totally use this too. Any moisturizer with virgin coconut oil, and ideally monolaurin would be good. But keep in mind, again, no fragrance, no preservatives, and no dyes if you can help it. Obviously, also even better is pure virgin coconut oil. This is oil as well. And the reason why we recommend this too is because it has monolaurin in it. So it's a wonderful option. So again, wash your hands with a gentle cream or liquid cleanser, ideally with SLS. No fragrance, no allergens, no dyes, no preservatives, nothing like that. And then follow immediately with virgin coconut oil or another moisturizer. Even the European Task Force on Contact Dermatitis is recommending this, right? Gentler soaps and cleansers, and then follow with an emollient, a humectant. And then for some people, particularly those who are using gloves and stuff, you might want to add a barrier protectant thing, like Armada Baby or Armada post-procedure, or any purely mineral sunscreen that you can get your hands on. Mineral is important because it doesn't get absorbed in the skin. It actually sticks on the surface of the skin. So it's really a physical barrier that can help prevent some contact with some of the allergens, latex, rubber, antibacterials, colors, preservatives in a lot of the PPE, okay? So there. And then in as much as, so that's prevention. Use hypoallergenic, non-comedogenic, non-acnegenic stuff in everything. So shampoo, conditioner, cleanser, moisturizer, sunscreen, makeup. This will really help prevent maskne and rashes and all this other stuff that happens. Then the second step of our approach, I said prevention, protection, and repair, right? So for protection, you might also want to consider antimicrobial protective products that aren't so abrasive and harsh on the skin, but crucially are still as effective. We have a great review on vmvinskin.com on the multiple clinical studies published on virgin coconut oil, monolaurin, and other coconut oil derivatives being so effective as antimicrobials, including antivirals, including on enveloped viruses like the Argentinian Junin fever virus, etc. I mention this because it's as effective as alcohol, basically, it's been shown. To get alcohol effective, you need about 80% of it, 70% of it. Monolaurin at much smaller percentages has been proven to be as effective on similar viruses, on the same stuff. So anyway, point is, if you can add or substitute sometimes your protective products, we tend to add. So what'll happen is after we come in from outside, even in our plant and our clinic, we'll ask people to wash with Superwash on the hands up to the elbows, or with a super skin cleanser here and on the face, and then to apply kid gloves, monolaurin hand gel, or monolaurin gel on the hands, even under the nails. And this is a technique my mother loves, and it's a bit funny, up the nose, seriously. And then to add virgin coconut oil, particularly virgin coconut oil with monolaurin, again over the hands, over here, and yes, in the nose. And she says, get it in there and rub it around, because you want to break down the fatty acids, which is where you get the antiviral protection. And I don't use my fingers, I use a tissue. So I put like a little bit of coconut oil on there, and I get on up there and do what I gotta do. It's lovely. It's so pretty. So those are the main things in terms of protection. And then repair. So finally, when you're done going out, or you're done taking care of people and being heroic, do be extra kind to your skin. Some options are Calm the Heck Down Balm, which is great when there's a lot of redness or itching. Very inflamed skin already from abrasions from masks and whatnot. Boo Boo Balm, classic, right? To get the skin healing more quickly if there are actual cuts on there already. And then if there's maskne, I would encourage you to try to get not hardcore. Some of the antibacterials that are effective for acne, first of all, may not work. It may not be bacteria acne, right? Second, they can be really, really irritating. And third, some of them are allergens. So again, if you can opt for acne treatments that are less abrasive, less irritating, and don't have other allergens in the formulation, I would highly recommend that. For that, we have Redbetter Spot Corrector, which is far less drying than anything else out there, and monolaurin gel. And as you can see, a lot of this is multitasking, which is great as well, because then you don't need so much stuff. So on that note, before I forget, we have specials on vmvhypoallergenics.com internationally and .ph in the Philippines. In the Philippines, we're offering mini-sized versions of our Stay Safe kit, which is a lot of the stuff that I was mentioning earlier, but in travel sizes, which is really great for when you're just going back to work or you have a quick errand. It's good to bring with you in case you need them. And then in the USA, we're offering a self-care kit that you can customize with travel-sized versions of a lot of this stuff. And you get little pouches and drawstring, which is nice little gifts in the time of COVID. It's always nice to get in the mail. And it is National Lipstick Month. So we are offering 40% off our lipsticks and lip glosses when you get 2. And again, it's these little luxuries that help. And again, it's nice to know, you're keeping this area safe with gentle products and whatnot. And before I forget, Maskne might greatly be helped by just switching toothpastes to our Essence Skin Saving toothpaste, which doesn't have allergens or halogens or comedogens and stuff. So on that note, I will be calling in my mom so that she can really delve into the importance of barrier care and stuff. I don't know where she is though. Hold on. Mom. Hi. Are you here? She's coming. Here she is. The reason really for y'all to be here. Is she coming? Doctora? I thought she was right behind me. I'm sorry.
Hello.
So if you have more questions about VMV, stick around after she goes and I'll get to those as well. So here she is.
Hi, everybody. Hello.
Hi. Hello. So here, you need to make sure you're in that frame too. Why don't you move this way? There you go. Right?
Okay. Oh, wow. Okay, great.
So we're on both. Whoops. It says our video ended on Instagram. Is that true? Is that true? I don't think so. Is that true? Let me just double check. On Insta. Okay. So.
It's working?
I think so.
Okay.
So introducing my mom again, Dr. Viralio Rowell, rather famous dermatologist, dermatopathologist,
Okay.
over 200 clinical studies published all around the world, has been working on, you name it, contact dermatitis, psoriasis, photomedicine since the Pleistocene era. Has actually crucially a lot of clinical studies published specifically on the novel antimicrobial effects of, say, VCO and monolaurin. So she's the perfect person to have with us, and has been doing a lot of stuff on anti-inflammatory everything for skin, diet, acne, etc.
Psoriasis.
So say hi.
Hi.
And she looks fabulous all the time. I mean, really, I just wilt next to her. So let's start with some figures I read recently, which is a study out of Wuhan showed that 74% of health workers had reported skin reactions, and some skin reactions included dry skin due to frequent hand washing, and then PPEs, and then Maskne, of course, which everyone is talking about. So much so that the European Task Force on Contact Dermatitis issued a statement on COVID-19 and the risk of skin reactions in the Journal of European Academy of Dermatology and Venereology. So are the numbers really rising? What really do we have to be concerned about? Could you give us an overview?
Right. It really is rising because what happens when you use a disinfectant being the kinds of chemicals that you would be wiping on dry, whatever, items, including in the kitchen or in the bathroom. Whereas antiseptics are the products that you would be applying on your skin. Both of them contain usually rather strong chemicals that denature the skin or denature the thing. And the thing is that they contain usually chlorinated hydrocarbons. The most common, for instance, is triclocarban or triclosan or any of the chlorinated hydrocarbons out there. And the thing about them is that they, like, you know, when you go near the pool, you can actually smell the chlorine rising up because it evaporates. And so therefore, as it does that, and more people, let alone, let's go to the PPE later and all that, but inside the houses, we're using it quite a bit because we're so worried about getting this virus. So the bathroom, the kitchen, the floors, the tables, etc. are treated with these disinfectants and antiseptics. Rises up in the air. In places where you're exposed to sunlight, because many people are indoors and so they usually sit beside the windows. So those will make the UVB may not be able to come, but the UVA does, and they can react with those chlorinated hydrocarbons,
to cause
the chlorine that comes out,
hyperpigmentations.
and it can produce irritations, photoallergy, pigmentations in exposed areas. I see quite a bit. There really has to be a paper already on the effects of the chlorine inside and on the skin. Then for people who are using...
Okay, so chlorine is a big issue because it's in a lot of disinfectants.
Right.
And even if you don't use it on your face, you don't actually put it on your skin, even if you're good, you're wearing gloves and you're you know, bleaching and disinfecting and stuff, what she's saying that is really important to remember is a lot of this stuff is airborne.
Right.
So it really goes up. I am extremely sensitive to chlorine, so it'll actually make me want to vomit just from smelling it, and my eyes will burn and stuff. But on your skin, even the airborne particles can definitely cause these problems that she's saying.
That's right.
Hyperpigmentations, redness, rashes. Are you seeing acne from that as well?
Oh yes, we can go into the halogen acne because that's
Exactly.
another one. And so the other thing is that in addition, people who have sensitive mucosa, like people who tend to have rhinitis or asthma or are using steroid containing inhalers, what happens is that they really become very irritated. And so people will say, how come I'm getting asthma now? Or, I'm coughing and whatever. It may just be really from the chlorinated hydrocarbons that are coming up into the air and irritating you.
Okay, so this is something a lot of people don't even talk about, right? Is the idea of bleach and chlorinated hydrocarbons, so chlorine, basically, right? So then what else is causing what skin problems that, we're seeing? Like maskne, the abrasions, the redness, the dryness of the hands and all
So,
that.
okay, besides the photoreaction of the skin, what happens with the chlorine also is that just like it denatures the cell membrane of the organisms that you're trying to kill, it also denatures the surface skin that we have. So being that the barrier layer of the skin is really compromised. So it becomes dry, it becomes flaky, it becomes scaly, it becomes itchy. It may sting, it may burn. All of this is really just due to the barrier repair, the stratum corneum being denatured, and so things become, there are nerves after all just beneath that, and so you get those symptoms. Then we can talk about halogen acne as well.
Yeah.
Okay. The halogens are bromides, chlorides, iodides, fluorides in steroids. If you're used to using steroids on the skin, by itself, you don't have to wait for COVID. It can produce acne around the mouth and around the nose, for instance. This is called halogen acne, belonging to the halogen group of chemicals, which, like I said, are also used in the disinfectants and antiseptics we tend to use nowadays.
Okay, so let me break some stuff down. Okay, so part of the concern during the age of COVID is the constant disinfection. Yeah. And we were talking about chlorine being a top bleach that everyone uses to disinfect, which is great, except it has a few problems. One of them is it's airborne, so it can waft up and you don't even know it. And with light, you can get hyperpigmentations, redness, rashes. Because it is a halogen, it's part of this group of chemicals called halogens, it can also cause halogen acne, which is actually why which is why we recommend a toothpaste without fluoride, right, for people with halogen acne.
Right.
So maskne can in part be because of the disinfection that you're constantly doing around you, not even the mask itself. It can be both. This is why I was talking earlier about the importance of prevention everywhere, right? And the mask itself, right, sometimes has allergens in it, or things that can rub against you and cause irritation of the pore, and then
very good
acne. Yeah, no, I listen. I do.
Because what she mentioned about irritation of the pore is what leads to acne. There are a lot of things, mechanical, irritation. The chemical by itself produces acne. So that's why over time, first the users of these masks complain, why am I so irritated? It's red, it's itchy, it stings, it burns in that area. And then slowly you'll start to get acne lesions as well. But there's a different kind of acne, which is pretty common in the Philippines, where we sweat a lot. And a lot of people nowadays stay indoors. That's good if they have air conditioning.
It's also summer in Europe and the States, though.
Oh,
so
there you
this might be
go.
an
So
issue.
be careful about this. You're staying indoors, you sweat a lot, you perspire. What happens? Together with the irritation of that pore and the fact that when the pore is clogged up, you should have little whiteheads and blackheads from it. And the sebum, the oil, is still being secreted because you're active, you're stressed, you're whatever. So that plus the clogged pore and the oil being produced a lot, what then happens is that microorganisms that are resident in the skin called fungi, malassezia, as well as the Demodex, which is a mite, believe it or not. The first time I tell this to patients, they look at me like, I got mites in my skin. Yeah, unfortunately, you
We
do.
kind of do.
But they have a nice name. It's called Demodex.
Yeah. But they're there. The critters are there.
Right. So, if it's mostly from sweating and from the barrier being destroyed, what I find is that the type of acne that occurs is more on the cape area and the back, and people come in and say, what am I getting? This is tiny little dot-like things. It's not like real acne, which comes in different sizes. You have what we call a comedone, blackhead, whitehead, and then it progresses and becomes a papule, a pustule, a cyst. All right? But
So,
not this.
yeah.
They're tiny little dot-like things, and it's very recognizable.
So
once you
that's
see it.
why it's I guess a key takeaway for me here whenever I hear her talk about this is don't assume the acne is just acne. It could be several different things at play, right? It could be a kind of fungus, in which case an antibacterial acne thing might not help you.
Antimicrobial towards fungus.
Right, and then it could be mites.
Oh, I
It
see,
could be
okay.
an overproliferation of Demodex.
Right.
In which case, again, a typical whatever may not work for you. You might need anti-lice medication.
That's right.
Which is why it's so important to talk to a dermatologist to make sure you know what the acne is.
Yes.
And also why prevention is so important, because there's so many things you're fighting against. I want to get to a few questions quickly.
Let me just
okay.
insert. One of my patients with this kind of a problem, he loves his little island, and so on a lake, and so he was sweating profusely because instead of staying indoors, he was cleaning up and doing minor, carpentry work, major as well. And before you knew it, he said, "What is happening to me? I have these irritations and all that," and they look funny and weird. Well, it turned out he was irritated, he had barrier problems, and he had organisms like Demodex and fungus. So rather than giving him the usual antimicrobial called an antibiotic against bacteria, I gave him instead the lice medicine or scabies medicine, just to apply it every evening for about a week or two. And then I also gave him an antifungal, which we will talk about.
So it's different, right? But okay, let's get to a first question.
The antifungal I'm thinking about
going to interrupt.
should not should.
Right, sorry. So all of this stuff that she's talking about should not further irritate the barrier.
Thank you. Sorry.
Please try to use no fragrance, no problem. That's important. No fragrance, no allergens. So wait, another crucial thing I was sharing with them is reading that task force of contact dermatitis statement. They were saying just washing your hands that much, period, is already irritating and can really dry out your hands.
Absolutely.
So a main thing they recommend is soaps, maybe not so much cream cleanser, liquid cleanser, but definitely no fragrance, no allergens, right? And then they said immediately after, add an emollient, add a moisturizer. She really likes virgin coconut oil. She really likes Monolaurin. We'll get to that in a second. But the first question here is from Gwen on Facebook and Insta. A derma previously advised that it's not really a good idea to moisturize due to the Philippines' hot climate or humidity. So if you're in hot and humid weather, a person is asserting not to use moisturizer because it's too hot and humid. Exfoliating, yes, but not moisturizing. But what if I have oily and combination skin? So I think the question is using a moisturizer okay in hot and humid weather? And if I have oily and combination skin,
Yeah.
right? And the answer is
Normally, you don't use that much oil or moisturizer when you already have dry, oily skin anyway, and you have a lot of humidity, and therefore water is there, and so transepidermal water loss. It doesn't matter because there's water from the air. However, the fact is, our cells that have been denatured need lipids.
They're
like
made of
every
lipids.
cell in
Fats,
our body
oils, yeah.
has a lipid bilayer. Practically all cells in our body, and even the little what we call spots that are inside a cell, they also have lipids, because lipids are needed for transporting information from one cell to another, from one part of the cell to another, and so you can't just have water.
yeah, it's really
Water
necessary.
is good to moisture, but you need
to
oil.
replace the lost lipids.
Exactly.
Particularly the lipids that are being abraded away by all the washing and stuff. I think, though, maybe part of your question, Gwen, if I can assume, no, is I think that your dermatologist might have been saying don't use comedogenic moisturizers, or acnegenic moisturizers, because they do exist, right? So things that are comedogens sit on the surface of the skin and they clog the pore. And that will cause bumps and stuff like that. Things that are acnegens will start off as causing a comedogen, right? And then an inflammation will follow, an infection, which is why even allergens can be acnegens, because they can irritate and cause inflammation. So as long as you're using, first, a moisturizer is necessary, especially with all of the disinfection and the washing and all of the stuff, because the skin does get denatured. It gets so dried out, and our cells are made up of lipids. So much of it is lipids, fats, oils. They need that to stay healthy and stay intact. Right. And I mentioned this earlier. She always talks about when the barrier is really denatured, it develops cracks, and it becomes very welcoming for secondary infections. And then now you have a whole different headache to deal with. Right. On the note of comedogenicity and acnegenicity, we have another question from Portia. Is coconut oil comedogenic? And the short answer is no. Every place that lists coconut oil is comedogenic they're using very old 1960s and 70s studies done on rabbit ear assays, which were not consistent to begin with, have since been debunked by Dr. Drelos et al., so many people that have since used newer methodologies on actual human skin, on people. So no, a lot of that stuff is based on really old things. We have an article on it on vmvinskin.com on acnegenicity, comedogenicity, and all those old studies versus the newer ones. And it's also on our IGTV, our live stream replay on Instagram.
Dr. Katambay, I'd like to mention this fellow. He was one of my residents at the time. He's got a nice practice now as a dermatologist. We actually did a study based upon that paper that Dr. Drelos did, showing that compared to other oils, coconut oil was not at all a comedogen. And as a matter of fact, there is an oil that I will not mention here. You can just read the paper maybe. That is actually, it's a common one that people like to use in their skin, and it is a comedogen.
Okay. One more question from, Ihopi. I just realized if you're in LA, that might be Ihopi in Los Angeles in vez de Hijopi, which I've been saying. Sorry. So anyway, can we use kid gloves on the face? I do. She does.
I do, yeah.
I told her she actually does the... I'm not sure you want to see me be sticking this up here, but she does.
It's so much simpler, and this is clean.
So what she tends to do is like hand gel like this, and then... And I use it, or if I've run out...
I breathe it in.
Oh my God. She also does that with VCO. Actually, I do that with VCO too. I'll put a little bit on tissue, and then I'll stick it up there and rub it around, and then I'll go to really inhale it. Yeah, we're hardcore in this house. So if I don't have kid gloves, I use gel. Sorry.
Okay, going on.
Anyway, I'm sorry. And no. Sorry, I'll answer all that stuff later. My bad. Sorry. Okay. So then going back to Ppe Dermatitis. Mm-hmm. Some of the other stuff I've read is where the mask presses up against your skin, right? And rubs up against it. So you'll see it here on the bridge of the nose, here and here maybe. Is that just from abrasion?
The mechanical effect is the abrasion she's talking about, and yes, that's one very major part of it. But there are other things. The fact is that some of them are manufactured elsewhere, and the material, whether it's the cloth or the outside blue-green, if you're using the surgical mask, or even those things that they apply, most manufacturers always use a preservative. And now that preservative is usually just airborne or whatever. But if it's used constantly and directly on the skin, in places that you are putting more pressure on the skin, you will definitely get a pressure, urticaria, pressure, irritation, pressure, irritant contact dermatitis from the chemicals that are used to preserve those.
Right. So the irritation, if I'm hearing you right, is from both the mechanical, which she calls mechanical, what I call like really physical. So it's not cellular or molecular. It's really the physical rubbing.
Right.
Okay. That's mechanical against these materials. It's like if I took this shirt and just rubbed it constantly all day. Eventually, it'll hurt,
Some of them also have color.
Hmm.
And dyes are one of the most common allergens on earth, which is the reason for this white hair, by the way.
Ah, it's fabulous.
Very allergic to dyes. So, therefore, when you're putting it on and it's close in contact, and some people I see wear black or colors, just to be exciting when you're wearing it. The dye is normally put on material which is not 100% cotton. And anything which is not 100% cotton has dye chemicals that are, with sweating, with irritation, easy to go into the skin as well.
So again, two things. We're looking at mask, and masks include multiple types of masks, including the cloth masks, goggles, right, and gloves and such. You're worried about mechanical irritation, so irritation from mechanical rubbing,
Right.
and then also because a lot of these materials contain allergens, chemicals that can elicit irritant or allergic reactions, and those include dyes. They can include very specific sort of antibiotic solutions that are there. They can have other things called mordants, maybe, especially if they're not a natural fiber material, which is like a metal-related substance.
There you go.
And metals, nickel is the number one allergen always, right? Metal, a metal-related chemical to help color bind better to the material. So if you're using like a bright pink cloth mask, that might be an issue.
Right.
Because they might, and it's not even like a pure cotton mask, that might be a real issue because of the dye and because of any mordants that are added to the cloth to help the dye make kapit, like really stick to the cloth. So several things to be concerned about there. Someone loves your necklace, by the way.
Thank you.
Okay. A question from Myla and a related question from the Good Hunter. Is azelaic acid the best for acne? And is there an alternative for azelaic acid for acne? And I'm already using Benzac at night. So, okay. There's a lot.
In preparation for this, I actually reviewed the newest literature about all of the things that can be used for acne. And there's really no best. I mean, we can go from the sulfur, the benzoyl peroxide, and all that. There's no best in the sense that it depends upon the patient and the circumstances the doctor is giving the anti-acne for. So, if you have a tendency to become reddish, and if the lesion is more on the inflamed kind of lesions, I tend to like to use azelaic acid. It's exciting. I actually did 3 studies on azelaic acid way back in the 80s.
Yeah.
It's
actually a wonderful active.
It is. It reduces pigmentation, which we want, especially if you have a little bit of brown skin. It's very good for reducing pigmentation. It's good for small acne and inflamed acne lesions.
The thing is, it can be quite irritating. So it needs to be in a formulation where there's no other irritants, no other allergens.
Right.
You need to be using stuff that is hypoallergenic, no allergens, no irritants. And ideally, you're using it with your doctor's guidance.
Right. And azelaic acid, the third action it's actually anti-inflammatory. It's a natural derivative. But the thing, I think from fungus, let's leave that alone. But the thing is that the azelaic acid is anti-inflammatory. It acts on catalycidins and makes it an active chemical that, brings down the inflammation of rosacea or post-inflammation or during the inflammation of acne. So it's really a very good one. But again, you have to use these products based upon how the doctor examines you and finds out, is the diagnosis correct?
Right.
It may not be acne. It may be some other kind of stuff, you know.
So azelaic acid could be a great active, but so could other things. Salicylic acid might be a better option.
Mm-hmm. Even sulfur, old sulfur.
Good old sulfur, monolaurin. There's many. And again, though, if the acne isn't even acne, there are antibiotics that might be required. And if the acne isn't even acne, it might be like lice medicine. So you need a proper diagnosis, and it needs to be help. But I'm so happy the Good Butter was saying, we're helpful in her recovery, which is great. Hi, Joppy, I got that. Perfect. Okay, alam ko na. And Veron mentioned, yes, we do need moisturizer even in hot, humid weather because we can suffer transepidermal water loss. So All great questions, guys. Listen, we have about 7 minutes left. So again, I'm just reminding now to please get your questions in, because usually we have a mad rush of questions with about 3 minutes left, and we try to get them all in. But in a nutshell, trying to help people out, if a lot of the skin problems are physical abrasions, you know, they almost look like wounds, huh? Because they're really just abrasions here. Or if I have skin problems on my hands from wearing gloves, what are some of the tips that you have? Because I know you like using a gauze or something here,
Yes.
no?
I have hankies, for instance, white cotton hankies. And when I
And
tell
you can't
people,
breathe. Don't believe her. We tried that and she couldn't breathe.
get
and
the
we couldn't
loose
hear
one.
her.
Well, you can. I'm
My-
trying to get rid of any of the chemicals that I use in soap. So,
No, but
to
my
my patients, wait a second. What I say is get the softest cotton that you have, all right, and wash it in the Philippines right now. There is chlorine in the tap water. So what I tell patients is, for that, just hand wash it with distilled water, bottled drinking distilled water, and wash it and wash it well. Hang it dry where the wind can even carry out whatever soap you would really like to, because some people really can't get rid of using a soap. But if you have to, try a good hypoallergenic soap. Okay, so then you can put that in there, and it protects you from abrasion and all that, and make it a little bit looser, what you get as a mask, so that it's other. So some other people like to use gauze, sterile gauze. Again, sterile gauze means some formaldehyde kind of chemical was probably used to disinfect it. So there.
She'll try still. So if you can find an unbleached, natural material, that's usually best. That won't suffocate you, because breathing is important, folks. Let's not forget.
Right.
But yeah, what some people do is they'll put like a small piece of cloth, maybe even cut it. The point is that it should be a barrier between you and that abrasive material. For gloves, the European Task Force on Contact Derm suggested trying to put cotton gloves first before contact, because latex and rubber can be a real issue for people.
Although vinyl, if
Yeah.
I may interrupt, vinyl and nitrile are somewhat related, but I find many of my patients who are irritations in their hands from washing and all that, if they put this on, they're very happy.
Okay.
So you can try the vinyl and the nitrile. Some of them are colored blue. I'd stay away from that. Just use the transparent ones that they have.
Okay.
Yeah.
So going back to Maskne again, I really hope it's clearer for everybody what it's from. It can be from several things. It can be from just because the mask is here and you're hot and humid and sweating underneath that already can definitely cause acne. And it can be fungal, like when you're overly sweaty, you get sweat acne. So it's kind of a similar thing, right? In which case, an antibacterial acne treatment may not be a good idea. You might need an antifungal, right? But it could also be other things because of this environment that's become very friendly for the microbes. You could have Demodex, our little mites, kind of going crazy.
That's called folliculitis, by the way. That's really not acne. It looks like, but
Yeah,
isn't.
it looks like, but it's not. So your dermatologist, if they decide it looks like it might be Demodex kind of going on overdrive, they might actually prescribe literally lice medicine. So don't get freaked out. It's not for long. It's just to get them under control. It could be a reaction to chemicals in the air from your bleaching, different things. That could be halogen acne, which is why a fluoride-free toothpaste could be helpful. At least it's less halogens that you're exposed to. Maybe also lessen your intake of very salty foods, which have iodides. So Maskne isn't one thing. It is folliculitis, bumps, or acne, or contact dermatitis, potentially caused by many different possible things. So again, it's probably a good idea to get in touch with your dermatologist and have them look at you and go through a really thorough history.
This can become a very problematic thing as time goes on. It's only July, and the vaccine will probably not be
for a while.
For
And even
quite a while.
yeah, and even then it might be multiple
Right.
things of
Go see your
vaccines.
dermatologist.
Yeah.
The dermatologists, by the way, now are doing a lot of teleconsultation.
Yeah.
We are so lucky that visually
can, yeah.
we can see patient's
Exactly,
skin, you know.
exactly.
As a matter of fact, I'm doing quite a bit of
Teleconsultations.
I'm not advertising myself, but the fact
can.
is that the dermatologists can do a very, very thorough and good job of doing teleconsultations, and
yeah.
there are guidelines that are given to
Yeah.
us already. It's
Quite good.
fantastic. See your dermatologist.
Okay.
Don't think that you can just take care of it. No water, no oil, whatever.
So
Have your
guys, if you
dermatologist.
still have questions, Doctora, she has to go. She always has to go about this time. I stay on for another 10 minutes to try to answer any questions that she can't because they're brand related or whatever. But she does have she does have teleconsultations, and she has a bunch of research papers she's working on. So if you have any other questions for her, get them in. If not, we'll try to answer them later. But otherwise, I know you like to take this time to give a shout out to your people.
Right.
By the way, sorry, the one who said she liked her necklace, I mean, look, it comes with a bracelet. Sorry. Okay. So
Okay. And what was I going to say?
you normally like to give a
I'd
shout out.
like to say that to the person who asked about the water, the humidity, and therefore we don't need any oil. Let me just say that maybe that was your dermatologist. I don't want to downgrade my own colleagues, but the dermatologist probably was talking to you about during the time before COVID, right? So that therefore, that dermatologist probably said no need for oil because you're extremely oily to start with. But these are different times. The skin nowadays is acting very differently. There are many things that are. I will end this with saying, more and more, by the way, the earliest symptoms of COVID may be the skin before even the coughing, the anosmia, and the sore throat and all that. There are many articles already and many review articles that are coming out in our literature which shows that urticaria and rashes and itching and little pimple-like or red dots on the skin may actually precede the symptoms of what we call symptomatic COVID. Later on, when they're already in hospital, they may get even more red, what we call ecchymosis, and like their hemorrhages in the skin, especially on the feet.
Right.
So, yes, we are looking into those skin signs. If you develop any of those, ask your dermatologist also, what kind of a rash is this? Okay,
Yeah.
get an expert opinion.
Okay.
Okay.
So thank you so much.
Thank you so much. It's always a thrill.
I
love sitting with my daughter in this, and because she's so amazing. She learns so well and retains it.
I try.
Oh,
Love
okay.
you.
Bye-bye,
Have a
love
great
you.
day.
Mwah.
Okay, so yes, I'll continue for just another 10 minutes to try to make sure I get. Sorry, I'm not supposed to talk about certain products when she's there. I'm gonna get spanked. Is there a Super Skin 2 Monolaurin Mandelic Acid toner for the entire body? Yes, which is the Super Skin Mandelic Acid Monolaurin toner too. Most of our products can be used for face and body because we take an approach of prevention and hypoallergenicity, allergen-free, etc., etc. Most of it can honestly be used for face and body. So yeah, totally. I actually use it when I apply it. I apply it here, and then I get my hands as well. We already answered about azelaic acid. The store in New York, who was asking that? I saw that earlier. Oh, I lost you. I'm so sorry. I know someone was asking about when the store in New York was going to open. Oh, here we go. Rebecca. Yeah, we're really waiting on two things, which is the state of New York, specifically what they're allowing to open and when, and also the safety of our staff and clients. So we are selling over the phone at 212-217-2762, which you can find on VMVHypoallergenics.com. If you need personal assistance, Laura's there. Not Laura, Laura, my co-name in the United States. And she's awesome at really, really helping people with their orders and getting them on wait lists because, unfortunately, it's COVID has been very difficult to deal with from a production perspective because even we can't produce with as many shifts as we used to just out of safety reasons and government regulation reasons. And also our suppliers are much, much slower in getting stocks of the raw materials that we need in, or packaging materials even. So we're definitely having stock issues, but we're constantly sending everything that we can possibly produce immediately to all the countries where we are. And does Super Skin 2 come in bigger bottles? You know, it used to. And then it doesn't now, unfortunately. I'm sorry. But I love that idea, and we're going to explore it. In fact, one of our biggest initiatives is to be plastic free as quickly as possible. And so we're looking at bigger containers as well that would be more user friendly, more value friendly and all of that. And I'll make sure to bring this up in the next alignment meeting. So very quickly, I guess, in closing, I hope you got a better sense of what maskne is from. It's not one condition, it's several possible conditions, that some of which look like acne, some are folliculitis. It can come from abrasion, just the mask rubbing up against you. It can come from the material of the cloth, if it's rough. It can come from chlorine in the bleaches that you're using that waft up, and then you have halogen acne, which is why Super Skin toothpaste is a godsend, because it lessens your exposure to halogens. Also, look at your steroids, try to get off them as quickly as possible, but follow your doctor's instructions. It could also be mites, Demodex, kind of going bananas, in which case you might need a lice medication. It could be fungus. It could be the same stuff from sweat acne, right, that you get in other sweaty areas. So really ask your dermatologist just to be sure, because you don't want to be treating these bumps with the wrong thing. If you're using an antibiotic and it's a mite, it's just not going to work, right? And you might even exacerbate an irritation there. If you're a health worker and you have to use goggles or masks or whatever, as natural as possible unbleached material across the pressure points can be helpful. And cotton gloves before your gloves can be helpful. But this is why it's also so important. I said in the beginning, prevention. So use a cleanser with no allergens and comedogens. When you're washing your hands as well, so Superwash or one of the Super Skin cleansers, because they have SLS, which is a great antimicrobial as well. Immediately after hand washing, if your face is extremely dry and abraded, you might also want to do that. Immediately after washing, pure virgin coconut oil with monolaurin, or a great moisturizer with monolaurin, maybe a purely mineral sunscreen if you need an additional physical barrier on top of that. And then if you need stuff to calm down, Boo Boo Balm is our go-to, as is Calm the Heck Down Balm, particularly if it's very red and inflamed. And for your acne, you kind of have a pretty good bet with Super Skin too, because you have mandelic acid and monolaurin. But monolaurin gel is a great idea. It's multitasking. You can use it also on your hands for protection. And it's an antifungal as well. So it deals with multiple types of organisms, as does Redbetter Spot Corrector, which is less irritating. Sorry. And then, but do talk to your dermatologist, because it might be Demodex, in which case you would need the lice medication. Okay, so you can shop our products at vmvhypoallergenics.com internationally and .ph in the Philippines. We're also, I think, on Viber and a bunch of other places on social media. So make sure you try to find us wherever it's most convenient for you. Instagram, Facebook, YouTube, Viber, etc.
Do we have Twitter?
We do have Twitter. Thank you. And remember, if you have had a patch test and you're struggling trying to figure out what you can really use, you can DM us your patch test results, and we can customize recommendations for you based on your particular allergens or cross-reactants. And a lot of this stuff is on vmvinskin.com. Those of you who asked about comedogenicity and acnegenicity, there's a wonderful, fairly new article up there about the difference. What is really comedogenic? What is acnegenic? What is the difference? Etc., etc. And we'll be doing these live streams every Friday in Manila at 9 a.m., which is 9 p.m. Thursday, EST, Eastern Standard Time. All our replays are on IGTV, Facebook, and YouTube. And let us know in the comments, please, what topics you'd like us to cover, because we have covered a lot already, but we don't know if we're answering the questions that you need answered. So please let us know for sure. And I'm also happy to talk to you guys about a bunch of things or whatever on Instagram at Laura at VMV. So there. Thank you so much for viewing and asking questions, and I hope we were helpful. And yeah, we'll see you next week. Bye bye.
You get Facebook?
I'll get both because I have